Hi guys, so I'm back with another video. We did have our consultation yesterday and I'm so excited. We expected it to be a lot more stressful, for me anyway, but it wasn't. It was quick, easy, and painless. She got straight to the point. She knew what she was talking about. After the doctor's appointment, my husband did make a comment about how, you know, he really feels comfortable with her and how she knows what she's talking about. The other times that we've gone to see like any kind of specialists or to do any kind of tests, they made me feel very uncomfortable. I was a lot younger than I am now, and they would always give me a hard time. You know, they didn't take me seriously. They kept on saying, oh, let's keep on trying, just keep trying, and it's obviously it didn't work. So but yeah, she just went over like the basics, you know, asking questions, history, lifestyle questions. She asked how many times we were having sex, and a week, and I made a comment about every other day. We have sex every other day, and she was like, excellent. So that's a good thing. So what it was about basically is letting us know that there are steps. Right now our chances of getting pregnant are at 2%. A person that is two people that have healthy sperm and eggs are gonna typically have a 20% chance of getting pregnant in that month, from the day she starts her period, from the day she ovulates until she starts her period again. For us, it's 2%. It's a little disappointing to hear that, just because she did check over my husband's records, and it did show that he did have surgery for a varicocele, and what that is a vein that's enlarged in the testicle. What's in his loved one. He did have it removed in 2009, so she was a little concerned about that. She asked about his sperm count, and it came back that she did look it up on the computer and it was low. I'm not really sure if she really meant that he only had 2 million sperm count, but she said that out of 2 million sperm we would only need 20 of them if we do the in vitro. Getting back to that though, we do want to do some of the treatments. There's the IUI, that's going to be the first treatment. That's going to be the natural way. It's going to be where they're going to wash the sperm, they're going to inject it inside me, and it's going to fertilize the egg there. Where they're going to place that sperm is really close to the fallopian tubes. That way they have a short distance to travel instead of having to come all the way to the cervix, up to the fallopian tubes, and then back into the egg. So that was interesting to hear. But anyways, so the tests, I had a pap smear, I had an ultrasound, which was, I had to get one anyway, so they just wanted to do, you know, one-stop shop, which is fine with me because that way I don't have to go to another Kaiser. I actually had to go to a different facility than the normal one that I normally go to, just because they didn't, at my facility, they don't offer the infertility, so we had to go to a different one. So I just did all of that right there. We do have to go back. My husband has to get a semen analysis and blood work done. We're probably going to go on Wednesday for the blood work. For me, I have to wait until the first day of my next period, because they're going to test my eggs, they're going to test my HCG levels. It's really hard to say fast. And they're going to do the testing where they're going to put dye in my fallopian tubes to see if there's any blockage. I'm really disappointed right now because I was really excited that we were going to get tests done yesterday, but it didn't happen. I have to wait a whole month again. I had just ended my period. My husband and I were like, should we go now? Should we wait a little bit longer? Because we didn't know if they were going to have to do other tests where I would have to be off my period. So it's going to be a month before we can actually see any results from any of the tests that we've done. He's going to wait to do the semen analysis just because it's not easy going 3 days without having sex. It's kind of, I'm on a schedule and I need to follow that schedule. So that's it. We do have priority over other patients at this point, just because they need to have me on the first day, no spotting. It actually has to be like the bright pink blood before I can actually test for those. So I'm gonna get priority. All I gotta do is call them up, and then I would go, and that's when I would do the test. So I'm pretty excited about that. They do have a chart. We did get a chart. I will, if you guys want me to, let me know. I can totally put that picture like in an actual scene, or maybe post it on my next video. It actually tells you how much it's going to be. I don't know if you want to hear that now or just wait. We are going to do another video together just to see what he thinks about everything, because, you know, It's really cute when we're together. But yeah, so we have a chart letting us know the steps from which treatment leads to the next, My husband doesn't want me to do so many of like the injections. That's like they have 5 options. That's the 4th option. The last option is the in vitro. It's like the best one. She did say, like, if you're, you know, she put in perspective for us. If we want to have a baby, the best thing for us to do is be the in vitro. It is expensive, but it's worth it. It's gonna give me a higher % chance of getting pregnant instead of having to go through all these steps. My husband doesn't want me to do all the injections, so like the actual needles and hormone injections. He doesn't want me to do that. He doesn't feel comfortable with me taking all that and doesn't want me to go through so much pain. And I mean, I can handle the pain. He doesn't want to see me like that, which is perfectly understandable. There are very limited options for men though. That's like my biggest concern. A little part of me wanted it to be me, obviously, you know, because there's a lot of stuff that we can do for us, for women, you know. I mean, it might not be the fastest route, but we do have a lot of options. We do have a lot of solutions for us. For men though, she said if the semen analysis comes back low, then the next step would be to see a urologist, and that's a little scary just because, I mean, what else can they really do, you know? I haven't done my research about that just because I always kind of had a feeling it might have been me, but he's always told me no, it's him. So that's, you know, goes into the thing is feeling kind of hopeless. I mean, I don't know what else we can do. I mean, change our lifestyle, but who knows how long that'll take. And he's very stubborn. So when we get on camera with him, you'll see he's really stubborn and he doesn't listen to me when I talk about having to eat healthier. I mean, I've just barely got him off soda. He probably sneaks it and I don't know, but I'm trying to get off soda. I'm trying to get off soda, but it's a lot easier said than done. If you guys have any questions about anything, let us know. We can make an actual video. This is our first couple of videos and we're still new to it. So I'm not a very patient person, so I'm kind of annoyed at the fact that we have to wait, but you know, I have to do what I have to do. So, oh, and then she did say for men, if like there's nothing else for him to do, there can do either the artificial insemination or the in vitro. And my husband doesn't want to do an artificial insemination. We don't want a donor, so we're just going to do the in vitro. But we were going to do this next step. So it would probably be the IUI and then the Clomid. After that though, we're not going to do it anymore. It starts to get a little expensive after that. So thanks guys for watching, and let us know what you think. Ask any questions. I'm here. I'm open to answer anybody, anything. If you have questions for my husband, let me know as well, because I know he'll want to answer them as well. And then like and subscribe. We really appreciate that. And thanks guys. Have a good day.